I think we've made some significant improvements. I think on the national level there's a much better recognition by government generally of its role. You know, we've seen the latest being the sugar tax. I think within the health system the focus on prevention has increased. I think we see lots of good examples around interventions to improve secondary prevention for people with long-term conditions. I think possibly we've still got a way to go in terms of local authorities really being able to capture the opportunities that they have of improving the value and the programmes for public health and making that real radical turnaround in a local community environment. And I think, to be fair, that's a lot constrained by budgets. People have been fighting budget cuts. They've been grappling with having to make very, very difficult choices on how to spend public funds. And I think that has constrained their ability to be radical. So I'm looking forward to the future going forward, especially if we see the 10-year plan really start to give us the time frame that we need to invest in these sorts of programmes. But radical's quite a strong word.
Well, it was the word, I guess, that was in the 5-year forward view, which is why I use it. And I'd be quite challenging, I guess, to our NHS partners here that all the right words were there around prevention, but a lot of what we know needs to be done is actually quite well known and has been well known for a long time. So diabetes prevention and CVD prevention, we know the interventions, and the thing that I always come back to is the Chris Bentley stuff that he did in the Health and Equality Support Team. His mantra, as you know, was doing things systematically at scale that we know works. And doesn't the NHS need to do that?
I think doing things systematically at scale is important. I also think doing things to address health inequalities is really important. I think Sir Muir Gray has often said, we know how to do the right things. We're already doing the right things. We're just not doing them everywhere.
Yeah.
And that's stealing a quote from him.
Yeah, no, that's right.
But I think these are really... These are two really important elements. I'd like to think that as we move towards integrated care systems and new ways of payments that really do allow the resources to go to the right things, allow people to put the money where it's needed to really invest in prevention, that will help a lot. At the moment, it's very hard to move resources around the system given the constraints that we have.
And from your international experience and elsewhere, I mean, to what extent should we be looking to incentivise prevention better than we do?
I used to be a very strong advocate for incentive type of payment programmes. I'm actually less convinced that incentives is the right word. I think it's an allocative problem. It's about making sure that we make that the money is in the right place for people to buy the right things at the right time. And people don't really need the incentives to do the right thing, especially in the health system and in social care and in the prevention arena. People know what the right thing to do is. Many of them are trained to do the right things, and they've joined that profession because they're passionate about health and wellness. But they don't have the control over the resources. They can't put the resources where they need them to be. So I think we need to think about it as an allocative problem rather than necessarily an incentives problem.